Chapter 1. A real patient case. Scene 1. What exactly did this child go through? This is not a fictional story. This is something that really happened and was published in a case report. The patient was a 4-year-old boy from Iraq. In the beginning, no one imagined it would become this serious. The first clear signs appeared when he was 2 years and 3 months old. At first, nothing about it looked especially alarming. He would suddenly have these strange episodes. His head would turn to one side, and while playing, he would trip very easily. Each episode lasted about 10 minutes. There was no fever, no obvious eye symptoms, no nausea or vomiting, no headache, no clear weakness or tremor, and no history of head trauma. What made it so misleading was this: the episodes would pass on their own. At first, they happened only once every month or two. So what would most families think? Probably something like, was he just tired? Did he not get enough rest? So his family would put him to sleep. And when he woke up, he seemed normal again. And because of that, no one thought at first that this was a serious illness. But a few months later, the episodes started happening more and more often. That was when his family finally took him to see doctors. At the time, he had routine testing, an EEG, and brain imaging. All of them were reported as normal. In that setting, the initial working diagnosis was a migraine variant. He was treated at different points with ibuprofen, valproic acid, and coenzyme Q10. Later, he was switched to propranolol and other supplements. For a short time, the episodes seemed less frequent, and if the story had ended there, many people might have thought, maybe this was just an unusual but minor problem. Something recurrent, yes, but not truly frightening. But what really makes this case unsettling is what happened over the next year. A year later, his condition had clearly worsened. Those early episodes that had looked like just head turning and tripping became more frequent, lasted longer, and grew more severe. Eventually, he lost the ability to walk. And by then, this was no longer just a child moving a little strangely. He became poorly oriented,